In this video, I will list and describe the phases of the cardiac cycle, the functions of the heart valves, the pressure changes associated with blood flow through the heart, the physiological basis of heart sounds, how deflection of the ECG corresponds to activity of the heart through the cardiac cycle, define fibrillation, tachycardia, and bradycardia. The cardiac cycle is the period of time for one heartbeat. The word for contraction of a heart chamber is systole, and the word for relaxation of a heart chamber is diastole. Contraction of cardiac muscle is excited by intrinsic pacemaker cells found in the SA node within the right atrium of the heart. We start with that action potential spreading throughout the atria, causing depolarization. That triggers atrial systole. Then the action potential spreads from the atria down through into the ventricles. It's spreading through the intrinsic conduction system from the AV node through the AV bundle and bundle branches into the Purkinje fibers that branch throughout the myocardium of the ventricles. Following depolarization, the atria enter repolarization as the action potential spreads down from the AV node through the Purkinje fibers and then causes ventricular depolarization that activates ventricular systole. Repolarization follows at the end of the action potential and leads to ventricular diastole. The cardiac cycle begins with atrial systole, followed by isovolumetric contraction, which is the early phase of ventricular systole. During isovolumetric contraction, the blood pressure inside of the ventricles rises, but the blood volume inside of the ventricles remains constant. Then ventricular ejection occurs when the blood pressure inside of the ventricles is greater than the blood pressure inside of the arteries, and blood flows out of the ventricles into the arteries. Following ventricular ejection is isovolumetric relaxation, the early phase of ventricular diastole. During isovolumetric relaxation, the blood pressure inside of the ventricles is decreasing, but the blood volume inside of the ventricles remains constant. Ventricular filling occurs when the pressure of blood inside of the ventricles falls below the blood pressure inside of the atria, causing blood to flow from the atria into the ventricles. Electrocardiogram is a recording of the electrical activity of the heart taken with electrodes placed on the surface of the skin. The P wave results from atrial depolarization. The P wave occurs immediately before atrial systole because atrial depolarization is the stimulus that triggers atrial systole. The next deflection of the ECG is the QRS complex from atrial repolarization and ventricular depolarization. And the QRS complex occurs immediately before isovolumetric contraction because ventricular depolarization is the stimulus that triggers ventricular systole. The last deflection of the ECG, the T wave, occurs as a result of ventricular repolarization. Heart valves prevent backward flow of blood. Atrioventricular valves, AV valves, prevent blood from flowing backwards from the ventricles into the atria, and semilunar valves, SL valves, prevent blood from flowing backwards from the arteries into the ventricles. The AV valve on the right side of the heart, known as the tricuspid valve, prevents blood from flowing backwards out of the right ventricle into the right atrium. The bicuspid valve, also known as the mitral valve, is the AV valve on the left side of the heart, preventing blood from flowing backwards from the left ventricle into the left atrium. During ventricular filling, the AV valves are open and blood is flowing from the atria down into the ventricles. During isovolumetric contraction, the AV valves are forced closed, and it is the increasing blood pressure inside of the ventricles that causes the AV valves to be forced closed. Semilunar valves prevent blood from flowing backwards from the arteries into the ventricles. Here we see there's a aortic valve, also known as the left semilunar valve, which prevents blood from flowing backwards from the aorta into the left ventricle. And there's also a pulmonary valve, also known as the right semilunar valve, which prevents blood from flowing backwards from the pulmonary arteries into the right ventricle. The semilunar valves remain closed during isovolumetric contraction. Here we see that the semilunar valves open during ventricular ejection. And this is because the blood pressure inside of the ventricles is greater than the blood pressure inside of the arteries. This blood pressure forces open the semilunar valves, enabling blood to flow out of the ventricles into the arteries during ventricular ejection. The AV valves will remain closed until the blood pressure inside of the ventricles falls lower than the pressure inside of the atria. Once the blood pressure in the atria is greater than blood pressure in the ventricles, the AV valves open and ventricular filling occurs. Auscultation is the practice of listening to the sounds of the body. Using a stethoscope, we can listen to the heart sounds. The characteristic sound of the heartbeat is lub-dup. The lub is the first heart sound, or S1, resulting from the closing of the atrioventricular valves, the AV valves. Then the dup, or the second heart sound, S2, results from the closing of the semilunar valves, the SL valves. When listening to the heart sounds, the placement of the stethoscope will determine the relative volume of the sound coming from individual heart valves. The bell of the stethoscope on the left fifth intercostal space at midpoint of the clavicle near the apex of the heart allows us to hear the sounds coming from the mitral valve most loudly. Moving the stethoscope to listen to the individual valves can enable the diagnosis of abnormal heart sounds, such as a murmur that could result from a heart valve that does not close entirely, allowing some regurgitation. Pressure inside of the ventricles rises as we enter into isovolumetric contraction. This occurs at the same point as the first heart sounds, from closing of the AV valves at the beginning of isovolumetric contraction. As we enter ventricular ejection, the semilunar valves open when the pressure inside of the ventricles rises greater than the pressure inside of the arteries. Ventricular ejection proceeds until the semilunar valves close at the point when the pressure inside of the ventricle falls lower than the pressure inside of the arteries. The beginning of isovolumetric relaxation is marked by S2, the DUP, or the second heart sound. The electrocardiogram is a recording of the electrical activity of the heart. The P wave corresponds to depolarization of the atria. Next, the QRS complex results from repolarization of the atria and depolarization of the ventricles. Then the T wave corresponds to repolarization of the ventricles. The segments of the ECG are regions between two waves. For example, the P to R segment, you'll notice that the line of the electrocardiogram is flat during the P to R segment, and this corresponds to the plateau phase of the action potential in contractile cells of the atria. The ST segment corresponds to the time between completion of ventricular depolarization and the beginning of ventricular repolarization. During this S to T segment, the contractile cells in the ventricles are in the plateau phase of the action potential. We can also measure time intervals of the ECG. P to R interval is the time between the beginning of atrial depolarization and the beginning of ventricular depolarization. That's the amount of time that it takes for the action potential to travel from the SA node into the ventricles. Then the QT interval includes the ST segment as well as the QRS complex and T wave. The QT interval is the time between onset of ventricular depolarization until the completion of ventricular repolarization. Then R to R interval is a convenient way to measure the duration of one cardiac cycle. We can take the reciprocal of that to get the number of beats per second, and we just need to multiply by 60 seconds per minute, and that will then give us the heart rate. The P wave corresponds to atrial depolarization, and you can see that immediately following the P wave, the cardiac cycle enters atrial systole. The QRS complex corresponds to atrial repolarization and ventricular depolarization. Immediately following the QRS complex, the cardiac cycle enters atrial diastole and ventricular systole. Then ventricular diastole occurs immediately following the T wave. The SA node generates an action potential that spreads through the atria, leading to atrial depolarization, which we see the P wave corresponds to atrial depolarization. Then as atrial systole is occurring, we are in the P to R segment until the QRS complex results from atrial repolarization and ventricular depolarization. We see the action potential spreading from the AV node down through the AV bundle branches and Purkinje fibers, leading to ventricular depolarization. Then we have ventricular systole during the ST segment of the ECG. Major clinical application of the electrocardiogram is in the diagnosis of cardiac abnormalities such as arrhythmias. So an abnormal heart rhythm, an arrhythmia, or an uncoordinated atrial and ventricular pattern of contractions could be detected with an ECG. The first example of an arrhythmia we see here is this second degree block or a partial blockage. This occurs when atrial depolarization does not spread through the intrinsic conduction system to stimulate ventricular depolarization. The atria contracts without the ventricles contracting. What do you expect to happen to the pulse rate as a result of this blockage? Pulsing corresponds to blood entering the arteries, causing the arteries to expand with the increasing blood pressure that corresponds to ventricular ejection. In this second degree blockage, the heart is essentially skipping a beat. We're missing the ventricular systole, and it would cause a decrease in the pulse rate. Bradycardia refers to an abnormally low heart rate. Any heart rate less than 60 beats per minute at rest is technically classified as bradycardia. The next example we see here is atrial fibrillation. So fibrillation is irregular chaotic twitching of the myocardium, of the heart muscle. So this will occur if one region of the heart starts to depolarize, and rather than that depolarization spreading through the entire heart muscle, a separate region of the heart generates another action potential, and this leads to an uncoordinated pattern of contraction and an uncoordinated pattern of electrical activity in the heart muscle. Fibrillation will disrupt the efficiency of the heart's ability to pump blood. Atrial fibrillation is specifically the irregular twitching of the myocardium in the atria. While the atria is not contracting as a coordinated fashion to efficiently pump blood down into the ventricles, depolarization can spread down into the ventricles each time it's generated in the atria. And so this can lead to an abnormally elevated pulse rate, although the blood pressure would be decreased as a result of a loss of efficiency of the heart's ability to pump blood. Tachycardia refers to an abnormally elevated heart rate. A resting heart rate above 100 beats per minute is defined as tachycardia. The next example we see here, ventricular tachycardia, commonly just abbreviated VTAC. This is occurring when the action potential is being generated by an abnormal region of the heart, not being generated in the SA node, but instead being generated somewhere in the ventricles. Notice this unusual shape of the QRS complex. This characteristic shape results from the action potential being generated locally in the ventricles. This is an abnormal region of the heart functioning as a new pacemaker, an ectopic pacemaker, a pacemaker that's not found in the SA node, but is instead found in the ventricles. The last example we see here, ventricular fibrillation, commonly just abbreviated VFib, is a complete disruption in the electrical activity where the ventricles are having irregular chaotic twitching. During ventricular fibrillation, there would be no pulse because the heart muscle is not able to efficiently pump blood into the arteries. It's just having an irregular chaotic pattern of twitching instead of being able to produce a coordinated contraction necessary to pump blood.